Hello everybody, my name is Michelle Eldering and I'll be talking about my capstone project on the social determinants of health. I currently work as a case manager in primary care. I follow patients that have recently been discharged from the hospital and case manage patients that need ongoing complex care. I have a high percentage of patients that frequently use hospital services, whether that's the emergency department or frequent rehospitalizations. I'm part of a case management team that consists of about 25 to 30 nurses, all of which are embedded in primary care practices. The team operates within a large nationwide health system that includes a variety of healthcare settings. The name of my presentation was Determinants of Health. Does zip code matter? My capstone project was designed to provide the case management team with education on health disparities, the role of social determinants in influencing self-care, and population health. Since patients are followed throughout the lifespan in primary care, understanding the underlying causes of chronic conditions is important when improving health outcomes. Data shows us social determinants are a strong predictor of health. Though many nurses encounter these issues surrounding poor patient health, they report barriers in addressing these issues with their patients, such as feeling uncomfortable talking about it with patients, the lack of experience with these issues, and the lack of workplace support to deal with social determinants. For my project, I used the definition from the World Health Organization, which states the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by money, power, and resources. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status. Much of what is driving poor health is outside the healthcare system. When we're looking at the factors affecting health, whether it's good or bad, the health care that people receive contributes about 10% to their overall health. It's pretty small when we think about the larger factors contributing to health, like social status and behaviors such as diet, exercise, or smoking. Not surprisingly, chronic conditions are higher among low-income populations. For chronic conditions like hypertension and diabetes, roughly 1/3 of patients do not have disease control, and this percentage is even higher among minority and low-income populations. A middle-aged man in the poorest 1% of the population will die 15 years sooner than that same man at the top 1% of wealth. Disparities in health are disproportionate in relation to socioeconomic status, education, race, ethnicity, gender, sexual orientation, and zip code. People born disadvantaged have poor health throughout life. With the passage of the Affordable Care Act in 2010, more people are getting care in the outpatient setting. Previously, they had been getting care in the ED and during a hospital admission. Primary care wasn't set up to handle many of the issues surrounding poor health and the level of complex care required with advanced chronic disease. In order to keep patients out of the hospital, it requires an interprofessional team. This becomes important as we move to value-based care. If the case managers are tasked with keeping people out of the hospital and helping them to manage their disease, they need to have an understanding of the upstream problems that have led to chronic disease. The people most affected by social determinants of health may have a number of risk factors, such as economic instability, poor social supports, lack of access to healthy food or safe housing. These patients are at greatest risk for chronic disease and premature death. The majority of visits to primary care are to manage chronic conditions. Case managers need to have the skills to identify those risk factors outside of healthcare that are contributing to poor health. For my presentation, I used the information from the Healthy People 2020 website on the social determinants of health. Here's another table that's from the Kaiser Family Foundation that covers much of what the Healthy People 2020 website has. The primary social determinants are economic stability, neighborhood and physical environment, education, food, community and social context, and healthcare. The primary stakeholders are patients and their families. People in the lowest socioeconomic group are 3 times more likely to die before age 65 than those highest on the economic ladder, regardless of race or ethnicity. Other stakeholders are members of the interprofessional team, especially nurses. Nurses are often the ones that have firsthand knowledge of the negative impact of social determinants. Hospitals, outpatient care, and health systems are also stakeholders. People impacted by social determinants utilize the ED twice as often as the remaining portion of the population. The National Academy of Medicine recommends educating healthcare professionals on addressing the upstream problems associated with poor health and offers a framework to help stakeholders make improvements within their organizations related to health inequities. The supporting theory used for this project was Newman's systems model. This model offers a framework for nurses to follow when working with patients and the stressors they encounter. The patient is viewed as a system with a number of outside stressors that can impact the health and stability of the patient. Stressors can be physiological, sociocultural, or psychological in nature. Managing patient care in the outpatient setting allows for a more holistic view of the patient living within the community, which is compatible with Newman's model. I also used the adult learning theory. I thought this applied since the adult learners tend to be problem-oriented, and the development of the care plan at the end of the presentation provided a way for the nurses to use their knowledge of nursing along with the new material presented. I decided to use the leadership strategies of Florence Nightingale and Lillian Wald. Both nursing leaders understood that conditions in which people live and work have significant impact on health and survival. What these early nurses saw as environmental and social factors impacting health are not much different than the problems we see today. Nightingale and Wald demonstrate the long history nurses have of taking a central role in improving the health of the population. Improving patient safety relates to the initiatives of the Triple Aim and focuses on quality and satisfaction of the patient care experience. A culture of safety is achieved when each team member maintains accountability and shows willingness to problem solve when patient safety issues arise. Of course, patient safety always needs to be maintained when managing patient data. This is especially important since each day the case management team handles a large amount of patient data. The outcomes for this project were: the learner will be able to demonstrate an understanding of how social determinants of health influence population health, describe how social determinants of health impact self-care and disease management, identify barriers to improving health disparities, and lastly, create a plan of care using a case study to address barriers related to social determinants of health. I used a 5-point Likert scale for the evaluation questions to determine if outcomes were met. I used an online anonymous questionnaire consisting of 8 questions, ranging from strongly agree to strongly disagree. The first 5 questions were based on the project outcomes, and the remaining 3 questions were open-ended, allowing each of the nurses to free text an answer relating to overall effectiveness and ways to improve. For the first outcome of identifying barriers to improving health disparities, 88% of the nurses reported strongly agree and 12% reported agree. This outcome was met. Outcome 2, describing how social determinants of health impact self-care and disease management, 94% strongly agreed and 6% agreed this outcome was met. Outcome 3, demonstrating an understanding of how social determinants of health influence population health, 94% strongly agreed and 6% agreed this outcome was met. And the last outcome of creating a plan of care using a case study to address barriers related to social determinants of health, 94% strongly agreed and 6% agreed the outcome was met. Reading the comments from the free text, the nurses found the development of a care plan to be very helpful and would have liked more time spent on this. I would say overall the outcomes of my presentation were met. Now, with the provision of health insurance to those who were previously uninsured, more people are able to receive care in the outpatient setting. As healthcare prepares to move to a value-based payment system, the way we provide care needs to change. With the ACA's focus on preventive care and the model of a patient-centered medical home, the RN can provide much of that care. Since we don't have an electronic record that can keep track of the data we need to report quarterly, each case manager keeps a spreadsheet with the reportable data needed, such as hospital admissions, and of that number, how many were readmitted or seen in the ED within 30 days of discharge. From the data collected, it became clear much of what was driving these repeated admissions were social determinants. Data demonstrates that socioeconomic status is a strong predictor of health across the lifespan, as well as predicting the number of years a person will spend with disability. Nurses have a long history of identifying those that are most vulnerable. This project aligns with Provision 8 in the Code of Ethics for Nurses, which indicates that the role of the nurse is to contribute to the professional team by protecting human rights and promoting health to reduce health disparities. I think one of my biggest takeaways from doing all the research on this project was that social determinants not only have implications for those in the lowest percentage of wealth, it has an impact for everyone. For each gradient of wealth below the top 1%, health worsens for each economic stair-step down, to include those in middle income range as well. Ethnically diverse populations are disproportionately represented when it comes to health disparities. This becomes more important as our population grows more culturally diverse. There's lots of data that shows us the chronic stress, for example, from poverty and discrimination, impacts health later in life. The holistic perspective nurses bring to patient care makes them the most well-positioned team member to impact change. The National Academy of Medicine reports there's a lack of knowledge regarding how to go about transformational thinking to address social determinants. Even when social determinants have been identified, there's not a standard on how to capture this data in the electronic record. I have been interested in public health since I became a nurse, so this feels like an extension of that. However, the discipline of graduate school provided me the skills to bring nursing and public health together. My journey through the graduate program has provided me with the knowledge, skills, and values set forth by the American Association of Colleges of Nursing, such as leading change to improve quality outcomes, to advance the culture of nursing excellence through lifelong learning, building and leading interprofessional care teams, navigating across the healthcare system, and translating evidence into practice. Finishing this project has significance to me both personally and professionally. Personally, because I got to stretch my boundaries beyond what I thought I could do. Before starting this capstone class, I tried not to read too much about what was required because it was intimidating and I didn't want it to be a deterrent to finishing school. I knew once I was in the class I could divide it into small chunks, which I find much easier to manage and less overwhelming. Professionally, choosing this topic has helped me in my work role. The case managers are expected to be in a leadership role in the practice, and through the work required for this project, it has provided me with the knowledge to do this. There are a number of initiatives in place to expand case management in primary care, and through my presentation I was able to demonstrate the knowledge gained through my research. After I finished my presentation, my director expressed the desire to bring the presentation to senior leadership. I thought this was a good quote to end on. It always seems impossible until it's done. Thank you for listening, and thank you for making this a great capstone experience.